It's the Blue Vote Cafe, a little bit wonkish, a whole lot of fun. I'm David Schellenberg with Rachel Oyster, the co-chairs of Democrats Abroad in Canada's capital region in the beautiful city of Ottawa. Hello, Rachel.
Hello, David. It is a beautiful city.
We were just reminiscing that, Ottawa's going through politics at the moment. We're going to get a new mayor and a good new city council for the first time in a while. So
there's going to be a lot of turnover. Yeah, it should be.
It's like nobody wants to be a politician in Ottawa.
And why isn't all of Democrats Abroad discussing Ottawa's mayoral and city council races?
Yeah, there's actually some interesting candidates on it. I will give us that. This will be an interesting election.
It should be, indeed.
Who's with us today?
Today we welcome back Heather Stone, who has visited us before, but today she is joining us as the chair of the Medicare Portability Task Force. Welcome, Heather.
Thank you.
It's nice
Good to talk to both of you.
Yeah, nice to have you back on the pod.
Mm-hmm.
So, I suppose we should review with, I don't know if when we last spoke to you, our two customary questions were already a thing.
Yeah, so I was just looking back for that. It was the episode 14, Democracy and Elections Platform.
Oh my, and here we are at episode 56.
I think we're looking great. We've aged really well through these episodes.
Do we look exactly the same as we did at episode 14 or 1? So Heather, tell us, what state do you vote out of? Where do you live now? And what took you to there what keeps you there?
So I vote in New Jersey. I live in Israel. I live in the city of Tel Aviv. I've been here for 32 years.
Wow.
In Israel. I started out in Haifa, which is in the north, and I moved to Tel Aviv about 2 years into my stay in the country. Mm-hmm. And I started out doing some academic work at the Technion, which is like the MIT of Israel, working on some doctoral work in urban planning. I ended up ditching that because I got qualified to practice law here in Israel.
Cool.
And life is what happens when you're busy making other plans. And I got qualified to practice law. I got a job, met someone, got married, got a mortgage, 2 kids, got divorced, all kinds of stuff. Became a partner in a law firm.
Yeah. Wow.
Got a different mortgage.
Different mortgage.
So feeling somewhat settled in Israel.
Yes.
Like.
Yeah, I think I'm here for the long run.
And yet you can still vote in the United States, which is just endlessly fascinating, isn't it?
It is. And yes, and I have been in several different positions in Democrats Abroad Israel, including being chair during all of TFG's period.
Yes, you don't want to call it a reign, do you?
Yes, whatever that was.
Tenure?
Yes.
TFG?
Yes, the former guy.
The former guy. Okay.
So I was chair. Now I'm vice chair in Democrats Abroad Israel. And I do have another hat at the global level of being the Deputy International Counsel Global. But the reason why I'm here is because I am the chair of the Medicare Portability Task Force, and I'm very excited to talk about that with you both.
Yeah, we're excited to hear about it. I think it's been an interest of yours for a while.
Yes, and I did bring it up as a resolution at the May 2021 global meeting, and I'm very proud to say that it passed unanimously at that meeting. So
tell us what Medicare portability is.
Okay, so it turns out that Americans pay into Medicare when they're working in the United States. And many of our Americans who live overseas are people who have worked in the United States and have paid into Medicare, or they are working overseas and they are working for U.S. companies, and therefore they are continuing to pay into Medicare. When they get to retirement age, they want to opt into Medicare and they get all the paperwork for Medicare and they are told that their eligibility begins if they have a certain window in which to begin their Medicare process.
Okay.
And if they miss that window, they can incur penalties. So that's the first thing. The second thing is that Medicare, it breaks down into a couple of different parts. I'm sure people have heard, oh, I have Part A, I have Part B, I have Medicare Advantage, all kinds of things get thrown around when people start to talk about Medicare. But Medicare, the basic part of Medicare is Part A. And that is the part that people who have paid into Medicare through their employment have been covered by. But you don't get to use that if you are outside of the United States.
Right.
So while you have paid in, you don't get to use it. And many people who live in what we call the near abroad, which is where you folks live in Canada or Mexico or even as far away as Panama, travel back to the United States regularly in order to use their Medicare benefits for their health care. Right. So if they need something immediate, they may go see a doctor locally, but they schedule their regular treatments with their doctors in the United States, and they make Medicare-based appointments. Okay. That would be under Part B. Okay. So they acquire Part B insurance and pay the premium for Part B, or they acquire Medicare Advantage insurance, which covers the whole kit and caboodle. And that's how they handle things. But there are many parts of the world where Americans have nothing. This doesn't really apply to people in, let's say, Western Europe, who no matter whether you're a citizen or on a tourist visa, you're eligible to get the state health care. But in places like Thailand, Vietnam, Eastern Europe, Ukraine.
Well, what do you have? What do you have in Israel? Just fill us in a little bit of your current situation.
Okay, so Israel has a state-run health plans that everyone is eligible for,
right?
Including tourists and citizens, and so it doesn't really matter whether you're here permanently or if you're here for just a period of time. You can get health. You can get health coverage through the state plans. But there are plenty of places around the world where you cannot get those plans unless you are a citizen of that country. And most often, you're not even eligible to become a citizen of that country. So we have plenty of Americans who are living in places where they're married to someone who's a citizen of that country, but they themselves are not a citizen of that country. Wow. They are not eligible for health care. They cannot obtain insurance that covers them in that country because they are there permanently. They're not there as a visitor. And they have nothing to cover them.
Wow.
Really? Why can't they get insurance? They just can't get local insurance?
They can't because there's no insurance locally to cover them.
Of course. Right. Now I understand. Yeah.
There's no local insurance for them.
Yes.
And there is no travel insurance for them because they're living there permanently. They are permanent residents of whatever country. They are not there for a 6-month stay or a year stay.
Right.
Okay, which for which they would be able to obtain insurance from the United States.
Right.
Despite the fact they've already paid into this as a part of working in the United States initially. Yeah.
Right. And would be able to pay into a Medicare Advantage plan or into pay the Part B premium. So that is in the short, that is what we are trying to do, is to make sure that those people who would be able to derive benefit from getting those services, that they basically they're due that. They have paid into it.
Mm-hmm.
They worked their years.
They qualified.
They qualify for it. Shouldn't they be able to go to a hospital or go to a doctor locally and have those bills be submitted to an insurance company and be paid 80% on the bill or something like that?
Right.
Yeah, because that was the thought that was going through my head is, yes, they absolutely should, but I haven't a clue how you would implement it. So that would be the way to do it, is some sort of global insurance?
Well, yes. So what has happened, okay, and here I'll tell you the good news, okay, and then the we don't know news, okay?
The challenge.
Okay, so the good news is that the Medicare Portability Task Force was created as a result of this resolution that we had in May of 2021. We got up off the ground quite quickly, and in March of this year, March 2022, the Biden administration signed into law a major spending appropriations bill, which had two parts, both a domestic and a international appropriations. And on the domestic side, it included spending for a Medicare portability pilot program.
Wow.
So we are very, very happy about that. What we don't know is we don't know what this pilot program is going to look like. So,
has anyone asked us what we would like it to look like?
Well, yes, a few people have asked us, and we have sent them information. But on the other hand, the Centers for Medicare and Medicaid Innovation have not yet put forward the designated personnel in order to start planning the pilot program. So we are chasing after members of Congress and people from the White House in order to put pressure on the Centers for Medicare and Medicaid Innovation so that they will give this the necessary attention that it requires.
So let's say they form it. Well, I guess we don't. There's a limited degree to which we get any say in it. But do you envision it focusing on specific countries, like a pilot project would include Thailand and Vietnam?
Yes, exactly. Great question, Rachel. That's a great question.
So we
anticipate
Rachel gets a star.
We anticipate that it will be a handful of countries, maybe between 5 and 10 countries that it will select, and that the initial survey, pilot program would probably take about 1,000 people in each country. Right. Okay. And that perhaps it would be taking some people who are in the United States who have a desire to move overseas.
Oh, interesting.
Okay. And so that may be part of the program in order to see if there's like an interest in reducing the costs for Medicare in the immediate burden that Medicare is facing, to try to increase, have Americans who are currently in the Medicare system in the United States who would want to join family overseas.
Oh, because that was my next question. What does the U.S. get out of it? And what it gets is reducing the burden on Medicare in the States, because some of these people perhaps could be cared for by healthcare systems in their country of residence or the one they want to move to.
Exactly.
At a cheaper
And
rate. Aha.
so the cost to care for people who are of retirement age to statistical age of death,
Mm-hmm.
which I hate to talk about such things, but
But we've all
yes,
got one.
Yeah.
yes, but is approximately 66% over when it's done outside of the United States. So that's on average when
It's 66.
looking at
Okay.
when you're looking at countries like Korea, Israel, Germany, uh, Canada, Mexico as places that could be providers.
So you're saying the cost of caring for them in those countries outside the U.S. is 34% less than it would be caring for them in the U.S. should they travel.
Right. On average.
On average. Yes,
average.
understood.
On
Understood,
average. So
yeah.
some are a little less,
Oh, yeah, it'll be cheaper in
some are
Thailand
more
than
like,
Canada.
55% and some are
Right.
like
Understood.
72%. But
Right.
yes, on
If you can
average it
reduce-
comes out.
Yeah.
Exactly.
Fascinating.
Yeah, I
Okay.
wonder if it is in Canada, because I know what we charge for healthcare system, what Canada charges for healthcare system to people who don't live here is higher than we think it is.
Mm-hmm. Yeah, and that's why I was thinking it'll be cheaper in Thailand than it would be in Canada.
Yeah, exactly.
I would guess, but who knows?
But even if the cost that is charged to non-Canadians is higher than what is charged to Canadians, it may be much less than what it costs in the United States.
Mhm.
So that could be huge savings for the Medicare system. That's fascinating.
Exactly.
Mm-hmm.
So that's what's in it for the United States as a budget savings measure.
Mm-hmm.
And so the idea is to have a pilot program that will reduce costs to the Medicare system, that will allow Americans to do family reunification, provide medical services that are in native language for
Right.
Americans who are immigrants or first generation American and who want to have the language that they grew up in.
Mm-hmm.
And for Americans who are living overseas to become part of this program, particularly those in the near abroad and in countries where they're not able to obtain insurance.
Mm-hmm.
So initially, we think that the pilot will look at about 5 to 10 countries. We're hoping that it will take at least one country in Africa
Mm-hmm.
and a country in Asia and a
Yeah.
country, perhaps India, perhaps Thailand, and perhaps a country in Western Europe and a country in the Americas.
Right.
And it actually, I'm looking at it from, say, Canada's point of view. I can't see why Canada would be anything but welcoming of this idea, because it's bringing in dollars. I mean, we are covered when we're in Canada. We're covered by insurance, by the healthcare system.
Mm-hmm.
But if we qualify for Medicare and we are treated within the Canadian healthcare system, then that would bring in dollars into the Canadian healthcare system that it wouldn't otherwise get. Heather, this is a brilliant thing. Let's make it happen.
Well, I'm glad you think so, and we're hoping that that CMMI, that the Centers for Medicare and Medicaid Innovation, will start to move along
Mhm.
and progress in their planning of the pilot program. And we have been putting pressure on members of Congress and on the White House, as I said, to bring pressure upon CMMI so that they will know that they need to get this moving forthwith.
Right.
Mhm. Awesome.
The trick with these things is always in the details, and like to talk about the Canadian system, it's good and bad at the same time, in that if you're about to die, the system will take care of you. But if you need dental work, or if you go and see a doctor and the doctor prescribes you a prescription of some sort, that is not covered by the Canadian healthcare system. So when you talk about the Medicare that you're proposing, how far would it go to cover somebody's entire health, including their mental health?
Well, it would be what is covered now by Medicare. So if I understand correctly, Medicare does not, basic Medicare does not provide much in the way of mental health coverage.
Right.
Though some Medicare Advantage programs, because it is a free market insurance program, do provide some mental health coverage. And depending upon the kind of Medicare Advantage plan that may be offered to Americans overseas, that may be an element that is included.
Right.
But that is really an open question. I cannot say what would or would not be covered in terms
what
of
about
mental
dental?
health.
What about like dental and prescriptions?
Dental is part of the basic Medicare.
It is. Okay.
And yeah, there is an element of dental in basic Medicare.
Huh.
And prescriptions are also part of basic Medicare, though not every prescription is covered. Some items are considered outside.
So to
of the
some extent,
coverage.
it's going to be up to the individual. You have the choice when you sign up for Medicare of paying an extra premium to get Medicare Advantage or one of the other packages. And if you aren't interested in traveling back to the U.S. to use it, you might say no. But if it's portable and you could actually use it here, you might in fact opt to pay that extra money to have the better coverage.
Right. And if you don't live in a place where it's easy to travel back,
Yeah.
for many Americans who do not live in a country bordering the United States, it may be their only option is to pay the additional premium and be able to have insurance and be able to see a doctor in their country of residence and use that insurance.
Now, what about for those of us who are U.S. citizens but have never worked in the United States, or in some cases are the children of U.S. citizens who've never even been to the United States? How would they fit into all this?
Well, for those folks, I don't think this is going to truly apply to them because Medicare is much like Social Security is an earned benefit.
Right. And no way to buy into an insurance plan. It's just the way that it goes.
Yes.
Yeah.
Yes.
You've bought in with what you've contributed through your earnings over time.
Right. But for somebody like me who's never paid taxes in the United States because I've never worked there, I still want these benefits.
Of course you do. Yeah.
Yes, it would be nice to be able to make that. But for that, we would have to be working with our American friends who are in the United States for a Medicare for all kind of plan.
Yeah.
And then see if that would be something that could be made portable.
Right.
But that's a different ball of wax.
one step at a time. Yes, I know.
Yeah, it's a few steps down the road.
Yeah.
Coming back to something you said at the beginning, if you are living overseas and you have qualified for Medicare, you have a window to sign up in, and if you miss that window, you pay a penalty. Are you saying that's only...
I was going to go back to that question too, because I thought that was interesting.
Say what? So that's only for people who live outside the country? That doesn't apply to people living in the U.S.?
Well, if you live in the United States, it can also apply to you, but for the most part, for Americans who live in the United States, it happens to them automatically.
Huh.
Okay.
Yeah.
Because when they retire, their paperwork goes through automatically.
Right. You retire in
Okay.
the United States, and all of that goes through, and a bunch of things just happen as a part of the
Oh,
steps.
I see. In the U.S., it would go through
In the US.
automatically.
Okay.
I see. Okay. And when you're
Okay.
outside, you have to say, "Hey, I'm here. Don't forget
And
me."
I've
Right.
retired.
And you have to, yeah, you have to fill out a whole bunch of
Ah,
things. Now, there, it's possible to delay all of that by filling out paperwork and saying, I'm still working. Even though I'm
yeah.
of retirement age, I'm still
Yeah.
working, and therefore I don't want to start my Medicare.
Right.
Okay. So even though you're at that age, you don't get hit with the penalties automatically. You can just file and say, I'm still working.
Right.
Is there any reason you wouldn't want to put it in place when you become eligible? If you're, I mean, assuming,
Yes,
yeah,
because you're working. If you're working,
So
but it doesn't.
Medicare only kicks in when you retire.
yes.
Well, all the things I didn't know. That's what happens
Yes,
when you don't
it
live in the
only
United
kicks in
States.
when it only kicks in when you retire, and for people who don't have insurance, okay, that can be a problem if they're still working
Right. Yes,
and
because I could see
and
how
don't and aren't eligible for other insurance.
in certain cases, actually declaring retirement is a sort of a gray zone as opposed to a date on the calendar where everything changes.
Mm-hmm. True.
Yeah, with traditional jobs in sort of a union or factory environment or a government job, there's a day that you retire and then everything changes. There's a day you stop being a teacher. But if you're in more and more of these fuzzy jobs that a lot of us have that just never seem to end, how do you declare retirement?
Are you describing the gig economy?
Yeah, which I don't think is a new phenomenon, but
Fuzzy jobs that never seem to end. No,
it's just more certainly more accepted now than it used to be.
absolutely.
Sure. Well, when you decide you're retired, you need to let the government know.
Oh, okay. What I just suddenly realized is I guess I never really understood Medicare.
Ah,
Most people don't, but I do recommend one of our steering committee members. Her name is Tony Kamens, and she lives in Paris, and she has a Substack on Medicare. I will provide you with a link that you can put in the show notes.
Sure.
great.
For me, it still comes back to this fundamental thought of this is a benefit that I paid for.
Yeah.
If you were in a situation where you paid for this benefit, then I don't care if it's good or bad for the country or not. It's something that you have agreed to pay for, and the country does need to figure out a way to get that to you.
Yep.
Well, fundamental fairness never stopped anyone.
And how long has this project been going on? I mean, I get the feeling it's been consecutive governments of the United States on both political parties, and it doesn't feel like it's moving at all.
Well, I have to say, relatively speaking, it's moved pretty quickly in the sense that there have been efforts to move this forward for the last few years. About three Congresses, it managed to get through on the House side. Then the following year, it got through on the Senate side.
Oh,
This year,
no.
it got through, and it got signed by the president. So
That
I
is
think we did
progress.
really well.
Yeah.
I will mention that about 10 years ago, there was an initial effort by a member of DA Mexico to look into Medicare portability, and as a local project from Mexico. And unfortunately, that project did not move forward.
Oh.
So it's not something that is new to DA. DA has been interested in this project for many, many years.
Mm-hmm.
So how did you get roped into being the chair of the task force? Well, I mean,
No
I'm really
good-
asking what was
No
your...
good deed goes unpunished. I'll tell you. There is an organization, a nonprofit here in Israel that worked on getting this looked at by the Congress in the last two Congresses. I told you that It was approved once by the House and then again by the Senate, but not by both of them until this year. So this nonprofit, it's called the Governmental Savings Institute, and the head of that nonprofit is here in Israel. And he approached me to ask me if Democrats abroad would be interested in finding out more about the subject. And I said, sure, we'd be interested in finding out more about the subject. I knew we had looked into this subject earlier, 10 years earlier. And so I took some information about it. And I said, this actually looks very, very interesting. And I asked several people about it and started to collect more information. And it sort of snowballed from there. And once I decided to put together a resolution on the subject, well, then I was basically creating a job for myself.
As we do. But healthcare is such a fundamental thing for all of us. I mean,
it really is. And one of the things that we were able to do together with the Governmental Savings Institute was to do a full survey on the need for Medicare portability by all of our members. We sent the survey to all of Democrats abroad, all age groups, in order to get a fuller understanding of who would use Medicare portability and whether it would be something that people would take advantage of either for themselves or for family members. And it was quite interesting in revealing the results of the survey.
Oh, yeah?
And
tell us more about that.
Well, as I mentioned, we found that the biggest proportion of people who already go back to the United States are the people who are in the near abroad. We found certain countries where their people are underinsured or not insured at all. And those are mostly in Asia, Eastern Europe. We found that, and in Africa, actually, we found that there's about 30%, maybe a little bit more, almost close to 40% of people who are under 65 said that they had family members who would come and live with them if Medicare was portable.
That's huge.
Huge.
Yeah.
That it was a factor in the determination of whether or not their family would move.
Right.
And that if Medicare were portable, their family members would move.
Amazing.
Yeah, that's fascinating.
So what can Democrats Abroad members do to support you or to get involved?
Well, we would love it if people would get involved by sending us information about their own Medicare stories, about, paying into the system and wanting to have Medicare available to them or not being insured and looking for alternatives in the countries where they're located. We're going to be doing videos, video stories. And so we're looking for people who would want to participate in those video stories. You can write to us at Medicare at democratsabroad.org, and we'll be happy to collect those video stories. And if people are interested in getting involved in the steering committee, we'd be happy to have people get involved.
Excellent.
Wow. Okay. Is there anything that you haven't said that you want to be sure people know?
Healthcare is a fundamental right.
Something we know on an emotional level, but we need to repeat in those words.
Yes, exactly.
Absolutely. Absolutely. And when you hear these stories about folks who are living in places where they don't have health care or they're paying enormous sums in order to insure family members. It's outrageous. And especially if they would be able to have the benefits that they've paid into in the United States.
Yeah. Well, thanks for working on this.
Yes, exactly.
Well, that's what I'm here for.
Well, Heather Stone, thank you so much for joining us and explaining this incredibly fascinating and wonderful project you're working on.
Thank you so much for taking the time to talk about Medicare and Medicare portability. It's not always such an easy topic, and I appreciate your time and attention and terrific questions.
Thank you. I'm Rachel Oigster with David Schellenberg in Ottawa, Canada. Thank you for listening to Democrats Abroad, the Blue Vote Cafe.